Chapter 25, Fluid Balance Screencast 3. The previous screencast focused on fluid balance, so it makes sense that this screencast will be focusing on fluid imbalance. And when we look at fluid imbalance, this is what takes place if output is not equal to intake. We generally will organize fluid imbalances into 5 categories. They are volume depletion and volume excess. We're going to talk about those together. We're also going to talk about dehydration and hypotonic hydration. We want to keep those together. And we'll also, the 5th category is fluid sequestration. This is actually edema, and we spent a lot of this talking previously when we did vascular physiology and imbalances with filtration and reabsorption at the capillary level. Now, when we look at the first 4, they can be differentiated by 2 criteria. First, does the fluid imbalance change the osmolarity or plasma solute concentration? The second, is the fluid imbalance caused by excess of deficiency of body fluid? Now, these are going to be considered a fluid imbalance with a constant osmolarity. This is going to occur when the fluid lost or gained is isotonic. When we look at volume depletion, this will occur when isotonic fluid loss is greater than the gain of isotonic fluid. Examples would be when someone has a severe hemorrhage, burns, chronic vomiting, diarrhea, or hyposecretion of aldosterone. Volume excess, on the other hand, is when isotonic fluid gain is greater than the loss of isotonic fluid. Now, keep in mind, fluid intake is normal, but for some reason, there's decreased fluid loss through the kidneys. The important thing to remember here is there is no change in osmolarity, and more importantly, because there is no change in plasma solute concentration, there is not going to be any net movement of water between compartments. That's not going to be the case when we look at fluid imbalances that occur or result in a change in plasma solute concentration. The first that we're going to look at is dehydration. This is a condition that's going to exist when the loss of water is greater than the loss of solutes. Now, some common causes of dehydration could be profuse sweating, example, exercising in an extreme hot environment, diabetes, the intake of alcohol, maybe there is not enough ADH being secreted. It could be due to someone not drinking enough water, or another cause could be exposure to cold weather. In this situation, the plasma actually becomes hypertonic because there is less fluid. Water will shift from cells into the interstitial fluid and blood plasma. The consequence of this is possible dehydration of cells within our body. If we look at hypotonic hydration, this quite often is known as water intoxication. This is when the gain or retention of fluid is greater than that of solute gain or retention. This can result from too much ADH. It's usually due to drinking large amounts of plain water, but in a very short time. Please keep that in mind. You're not going to go into a situation of hypotonic hydration by drinking a lot of water across the day. Now, both sodium and water are lost during sweating. And remember, drinking water only replaces the water, but not the solutes. Now, the plasma becomes hypotonic, so fluid moving from blood plasma into interstitial fluid and into cells. The issue here is the possible swelling of cells. Cerebral edema is due to brain cell swelling. Cerebral edema can also result in convulsions, coma, and in very severe cases, death. Now, the last type is fluid sequestration. The body fluid is normal, but it is distributed in an abnormal way. The best example that I can give you is swelling or edema. Remember, this is puffiness with the accumulation of fluid in the interstitial space. If we look at ascites, this is just a much more specific accumulation of fluid, and it's occurring within the peritoneal cavity. Pericardial effusion, this is actually when fluid starts to accumulate within the pericardial cavity. And then we have pleural effusion, and this is the accumulation of fluid in the pleural cavity. Here we basically can see some situations here that are due to the increased formation of interstitial fluid, and remember, this potentially can occur during capillary exchange. If we look at the heart, kind of think about congestive heart failure or valves that aren't sealing correctly, and this can actually block blood up back in the capillaries. Veins, this could be due to faulty valves, so venous return of blood from capillaries is actually going to be impaired. If we look at blood, there could be an increased blood volume. This is going to increase blood hydrostatic pressure within the capillaries. In our capillaries, there can be an increased blood capillary permeability. This could be due to the release of histamine, various bacterial toxins, and a result of the aging process. If we look at the opposite, which is the decreased removal of interstitial fluid taking place during capillary exchange, let's think about lymph vessels. There could be the surgical removal or an obstruction of a lymph vessel or a faulty valve. Remember, we do have valves in our lymphatic vessels, and this is going to impair the return of lymph. And this is going to decrease the amount of interstitial fluid that's making its way back into circulation. If we look at blood, it could be due to decreased proteins or colloids within the blood, and this results in a decreased capillary oncotic pressure. So this is generally caused by either not enough proteins, which are synthesized by the liver, so very common when we look at liver disease, or the increased loss of proteins in urine, and less fluid will actually be absorbed into our blood capillaries. Now, we kind of talked about cerebral edema previously, and we need to remember that this is specific to the amount of fluid that is accumulating within the brain. It's important to remember that because the brain is encased within the skull, there really is no way of dissipating that pressure. So this results in a greatly increased pressure within our cranial cavity and is going to result in the compression of the vessels within the brain. This can cause headaches or nausea, and if we look at very severe cases, convulsions, coma, or death. Now, things that can actually cause cerebral edema would be an ischemic stroke, a hemorrhage within the brain, traumatic brain injury, a tumor within the brain, hypotonic hydration, and high altitude.